Good evening, ladies and gentlemen. I was triggered by something on social media, so that I decided to come and elaborate it in the simplest way that I can. It's about the HIV infection that has affected at least over 8 million people living in South Africa. I would like to tell the story of HIV and South Africa. Because recently I saw a post on social media from Department of Health saying that since 30 June, over 2 million people haven't collected their ARVs in South Africa. Meaning that there were illegal immigrants living outside of, maybe they're afraid or something, but it shows that the number that we had, the stats that we have in the year 2026, it was 8 million people living with HIV in South Africa. So which means they have reduced to 6 since the March in 30 June. The thing is that most of you African brothers, I think you still haven't got this, the play, the way it goes, you know, about the diseases and whatever. I saw the Ebola outbreak in Democratic of Congo and I thought to myself, this has to be another way of dealing with a black man. But anyways, let's jump into it. By 1986, the first person to be reported living with HIV in South Africa was a gay man from Europe, from overseas. He's the first ever person to be recorded with HIV in South Africa. And it has been confirmed that he was a gay because remember, at that period of time, from the 1980s, 1990s, HIV was looked at as a disease that was affecting gay people due to the fact that an anus is not really a sexual organ. So yeah, it is easy to kind of like transport diseases and whatsoever. So by 1992, from 1986 to 1992, places like Denmark, your Switzerland, your America, they've been suffering from HIV. And in South Africa, there's always only the people that were recorded were 166 people who were living with HIV by 1992, mind you. So the death toll, it was recorded in approximately 1995, 1996, that only 98 people have died from HIV. I don't know if it's up until the year 2000 or what, but it was only 98 people that were living with HIV. Meaning that many of the people living in South Africa, they were not yet infected with HIV. Up until the year 2000. In the year 2000, something happened. There was white philanthropists in South Africa with a company that was called SYMA. S-Y-M-A, or SYMA. Yes. So the company, its main objective was to eradicate the black people living in South Africa, to inject them literally with HIV, in an idea that they are saving them from maybe any kind of diseases that were coming to our country. So the companies were in Thokoza, Alexandra, Johannesburg, and as well as Pretoria. They mobilized so that they can literally infect the black people with HIV. Before that, HIV was kind of like non-existent into South Africa. By 1992, according to one of the activists in the United States of America, he said that if they were not able to see you for 7 days, it means that you were gone. There was no questions to be asked. They knew that you were dead from the HIV because it was a deadly disease. You understand? So since after 1992, across the world, they start manipulating numbers as if like HIV is not happening across the world. So the idea was to attack the capital of Africa, South Africa. Because once you deal with South Africans, then you can handle the rest. Because South Africa is the capital of Africa. That's where the cradle of humankind is, by the way. So after the year 2000, they mobilized themselves, injected the black people with HIV. Some of them were paid 10 bucks, by the way, 10 rand, to get an injection. They thought that maybe they were just protecting themselves or preventing for other diseases, only to find out that it was not a prevention. Actually, the people have been infected with HIV. By the year 2004, it has been reported that at least 900 people were dying every day from HIV living in South Africa. 900 people. From 166 people that were tested in 1992 to 900 people by 2004 dying every day from HIV and AIDS. It was a killer, guys. It was a killer. It was weaponized to eradicate the black people living in South Africa. Most of children who were born in the year 2000s, they were born with HIV, sorry. Most of children who were born in 2000s, they just don't know that. They were born with HIV. They didn't get the HIV through maybe sexual activities or anything like that. No. They were literally born with HIV. So recently, as they say that South Africa has over 8 million people living with HIV. It was not shocking, guys. It was weaponized so that they could eradicate the black people living in South Africa. There were white doctors, white philanthropists at the echelon who made sure that their job is to attack South Africa. It was not just only that. There's an apartheid doctor who goes by the doctor of Taboso. The apartheid government gave him a job. His main job was to find a disease that could at least kill only the black people living in South Africa. For more information, you can go to leave your comment on comment section so that we can have an open discussion, and then I can hear as well your thoughts about what is going on at this period of time with the idea of HIV and the way it's spreading. By the way, for those African brothers who left South Africa recently due to illegal status, staying in South Africa illegally, please get yourself tested because you are about to spread HIV in African countries that do not have ARVs. Thank you.